Hello, and welcome to Community Matters, sponsored by Bryn Mawr Trust. My name is Cindy Yovanov, and I'm the service manager at our Bryn Mawr branch located in Bryn Mawr, Pennsylvania. Today I have a couple of very distinguished guests with me, and we'll be talking about some of the research that's been going on with the American Lung Association, as well as talking about the Radnor Run, which is coming up here at the end of October. And I will introduce my guest to you now. I have Christy Dernlan here. She is the development director of the American Lung Association, and she has organized the Radnor Run for many years here in Pennsylvania. She does an amazing job. We also have Dr. Doraid Jarrar. He's the thoracic surgeon over at Penn Medicine. He's established some regional lung cancer screenings, and he's very well published on this topic and the topic of chest disease in general. So thank you both very much for being here today. It's really wonderful to have you. Christy, I'm going to start with you. I'm interested to know what's the mission, the overall mission of the American Lung Association. Can you tell us about that?
Sure. The American Lung Association has been around for 115 years. We're the oldest voluntary health organization. And our mission is to save lives by promoting lung health and preventing lung disease through research and education and advocacy. And we really work around four main strategic imperatives, which is to defeat lung cancer, to eliminate the burden of lung disease on individuals and their families, to improve the air we breathe, and to eliminate tobacco use and tobacco-related diseases. So a lot of work to be done.
Yeah. Well, maybe you can tell us a little bit about the Radnor Run and how that fits in with your mission.
Absolutely. The Radnor Run is a wonderful community event, and we're proud to partner with Penn Medicine. Penn Medicine has been the presenting sponsor of the Radnor Run for over 15 years, so it's a long-time partnership. The race happens, it's a 5-mile race through the roads in Wayne. It's beautiful, scenic. It's always the last Sunday in October, so we usually have the lovely fall foliage and hopefully the sun shining. But we gather together for a 5-mile race and then a 1-mile fun run and walk, so anybody can do it, any age. We also have a big health fair. Penn Medicine has a lot of their practices out there, sharing important information about health. The American Lung Association offers information. We have a lot of wonderful local and corporate sponsors. The Radnor Township is a huge partner in the race. The race starts and finishes on the grounds of the Township building. And Brandywine Realty Trust and the Radnor Hotel have been longtime partners. So we have a lot of great community support. And we come together for the mission to raise money for the American Lung Association. So one of the things that we're doing this year is trying to pay some special attention to lung cancer awareness. Because we're seeing more and more individuals and families from the community participate because they've been personally impacted by lung cancer. Right. And we have, people are impacted by all kinds of lung disease coming out. But we're just seeing this more and more families that have been affected by lung cancer. So we're going to have a lung cancer awareness tent at the race this year. Penn Medicine will be partnering with that and having some of their doctors and therapists out there to share information. We'll have lung cancer information from the American Lung Association. We have a lovely young woman who's a Radnor resident. She's 25 years old. She's going to be our lung champion. She's going to be kicking our race off. Her name is Ashley. She's 25 and she has lung cancer. She was a sophomore in college at Penn State University and went to see the school clinic because of some back pain and a cough. And before she knew it, she was diagnosed with stage 2 non-small cell lung cancer. She's fighting, and she lives here in Radnor, and she's going to participate. She's organizing a team of friends and family to come with her, and that's really what the Radnor Run's about. We've got people who are coming together in support of a loved one living with lung disease or in memory of someone who lost their battle. So it's an important day. So we've got this great race, which runners love because it's well established. This is our 41st year. It's been going on. It's hilly, it's challenging, but it's scenic. And then we've got this great opportunity to rally people around, a mission that means something to them.
Right. Well, I know how important the run is to the community. As a sponsor ourselves, Bryn Mawr Trust sponsors, I've run in the race before. The participation is amazing. Even on days where it may not be so nice, people come out and they still do it. Very important to lots of us here in the community. And we were talking about the research that's being done and some of the things that we can do to help raise awareness. And that's why we have the doctor here today, because he can shed some light on some of the things that are being done to not just create awareness, but to treat and prevent lung cancer. So Dr. Jarrar, thank you again for being here. We really appreciate you taking the time to be here. We know how busy you are. Maybe you can fill us in a little bit on some of the basic causes of lung cancer and the people that are generally more at risk.
Sure. Thanks for the opportunity. Everyone is at risk for lung cancer, but we do know that smoking, either current or prior smoking, it makes you at higher risk for developing lung cancer, including there's other circumstances such as radon exposure, which is found in the soil in Pennsylvania, asbestos exposure, which in conjunction with tobacco use can make you even at higher risk of developing lung cancer. And also we do believe that some environmental air pollution are contributing factors for developing lung cancer.
Wow. Well, I think there's some things there that maybe people weren't aware of, that they don't always think of. Smoking is an obvious one, but there are some other things that can contribute, definitely. So is lung cancer treatable, and what options do people have if they're interested in finding out more?
Sure. Lung cancer is very treatable, and as was pointed out by Christy, in conjunction with raising awareness and promoting research, which the American Lung Association has done, we have really made strides in treating lung cancer. Our main mission is really to raise awareness and actually, first of all, prevent lung cancer in the first place, but also what we call secondary prevention. Really, if somebody has lung cancer, detect it as early as possible, because then it's not only very treatable, it's also very curable, and that is our mission. And the one thing that we want to discuss today is awareness, and also lung cancer screening, which can be accomplished by a low-dose CAT scan of the chest. And patients that we consider at high risk are those who are current smokers or quit less than 15 years ago and have smoked a pack for 30 years and are ages 55 to 80. Those patients should discuss with their primary care physician the need for a annual surveillance low-dose CAT scan. They should there's also some online tools that they can fill in a questionnaire, a quick survey, and see if they're actually eligible for a low-dose CAT scan of the chest.
So where can they go to find that?
I'm sure they can go to the American Lung Association webpage.
Christy was talking about that earlier. So is that where they go to get that survey and take a look and see whether or not they would qualify for this screening?
Yes, the American Lung Association launched a Saved by the Scan campaign. You might have even seen PSAs on television about it, but it is trying to promote that awareness to people who have some kind of a smoking history, that there is a way to prevent lung cancer, or detect it, I should say, before it spreads, and that's key, because your rates of cure and survival are so much higher if it can be detected early stages before it spreads. So the Saved by the Scan campaign, on our website, www.lung.org, you can find our Saved by the Scan questionnaire, and you can take a step-by-step question that will show you if you qualify, if you're eligible to get a scan. And then it also gives you an opportunity to print out something to bring to your doctor that gives you kind of just some step-by-step, really easy ways to take that information and do something with it, which is what we want everybody to do.
It's one way for all of us to be more proactive in our healthcare and making sure that we know about these things and that we ask for them when we think we qualify for them or we need them. And I think I can't speak for you. I'm certainly not a doctor, but as a doctor, you would appreciate a patient coming to you and saying, this is something that I think I need. Can you help me? Point me in the right direction. Do you agree? Having those open dialogues with your doctor is more important now than ever. We're all so busy. So just making sure that you're being proactive in your own care. Well, thank you, Christy. That's really good information. So let me go back to the doctor for a minute. I know Christy talked about the relationship that Penn Medicine has with the American Lung Association, and you're a presenting sponsor of this run that's coming up, and you've been so for many years now. Can you talk a little bit more about that partnership?
So we have partnered with the American Lung Association for many years and many decades because we have we identified a common goal, improving the lives of our patients, reduce the burden of lung cancer, and we shared forces because by doing so we can raise awareness, get more patients to the right care, and also really raise the awareness of lung cancer screening. Again, that's our biggest goal for this month, that patients are aware that there are early detection screens that are very beneficial if they're the right age and have the correct exposure. And it's not being used as you just said. We all have busy lives. We don't use them, and we want patients to navigate their health as well. It's a very active reciprocal relationship, and patients should come to us, to their primary care physician, to their nurse practitioner, to their whoever provides care for them, and ask about if they're eligible for lung cancer screening.
Yeah, very important. Christy, I know we had spoken earlier too about something called Lung Force. Can you tell me a little bit about that?
Sure. And just to add to what Dr. Jarrar said, also part of our partnership has been specific research. The American Lung Association has funded lung cancer research at the University of Pennsylvania. And we all know that Penn Medicine is cutting edge when it comes to breakthroughs and advances and taking care of their patients. So there's a lot of ways that we cross over and can partner together. Another way is a lung cancer screening implementation guide that the American Lung Association and the American Thoracic Society came together and provided to help doctors and healthcare institutions with implementing those guides. And Penn Medicine has screening opportunities available at their facilities, of course. So Lung Force is American Lung Association's national campaign against lung cancer. And so we really just decided 5 years ago when we launched the campaign that we needed to focus really special energy towards lung cancer research, education, because the statistics, particularly in women, have skyrocketed in more women being diagnosed with lung cancer. Lung cancer is the #1 cancer killer of both men and women. So this is, of course, an important thing to tackle, and so we're trying to put we are putting energy towards that. We have education expos, which Penn Medicine has been a part of in the Philadelphia region and around the country. They're going on. We have walks where people can come together. We have one in the city in Philadelphia. It'll happen in May. There's one not far away in New Jersey that'll happen in April next year. And those, Penn Medicine, again, has partnered with us. They've had organized teams of employees to participate. But Lung Force is a lung cancer awareness initiative, and we're raising more money for research, lung cancer research specifically.
Is it specifically geared towards raising awareness with women?
Yeah, we want to focus that attention because we did a lung health barometer where we went out and surveyed women about their risks, and lung cancer was 1% on the radar of women. They weren't thinking that it was something that could affect them. And there are more and more women being diagnosed who hadn't smoked, so it's just not in their mind that that this could be a risk for them.
Right.
So that's part of the campaign.
Well, that's very important, it sounds like, then, to, as part of the overall awareness. There are certain groups of people that maybe we need to be focusing on. So Lung Force sounds like a great initiative. Now, Dr. Jarrar, you already kind of answered this question, but are there any other places you can think of that people might be able to go to learn more about prevention and screening?
Okay. Well, I want to comment on Christy's elaboration that we appreciate the partnership with the American Lung Association because as you had said, lung cancer is the #1 cancer killer in this country and worldwide. It kills more patients than breast cancer, colon cancer, and prostate cancer combined. Wow. And research funding is scarce. The national funding is scarce, so we certainly appreciate funding from the American Lung Association. And a lot of things have happened recently in the last couple of years. We have made tremendous strides, and including surgical technique, including chemotherapy, now with the kind of expansion of immunotherapy and very specific tailored personalized medicine and chemotherapy where patients survive much longer with better quality or actually many times beat the cancer. So things have really changed in a rapid pace in the last couple of years. And but again, at our heart is still secondary prevention, finding it early, because that still gives us the best chance for cure. So again, also Penn Medicine does have a web page where you can actually fill out a survey and get connected with a physician or a healthcare provider to see if you're eligible and get a CAT scan of the chest. And important is also that that there's a follow-up on the CAT scan. It needs to be read by an expert radiologist. It's a low-dose CAT scan of the chest that exposes you to very little radiation, unlike in the past. So it's a very safe scan, and it gives us a very good quality image of your chest, and it lets us find nodules early and determine if they're cancerous. Many times, if you are found to have a nodule on your screening CAT scan, it's actually benign, but you need a specialist to follow up on the nodule, kind of reassure you what the next steps are. And many times you probably need another scan a couple months down the road just to kind of confirm that this nodule indeed is benign and does not require immediate surgical attention or treatment attention. So again, a team of experts is important, including pulmonologists, medical oncology, and sometimes surgery, to kind of look at these scans and get together. We have a conference where we look at the scans all together and actually kind of come up with the best recommendation, because at the end of the day, every patient is an individual. Every nodule looks a little different, and everybody has a different history, family history of lung cancer, any exposure that might increase the risk or lower it, and so we have to make a personalized decision, and so we can offer that at Penn Medicine in conjunction with the American Lung Association.
Well, we're very lucky to have you both working so hard towards making this go away. I'm sure we've got a long way to go, but we've come a long way too.
That's true. That's
especially
true.
It sounds like in the last few years.
Absolutely.
Well, it's wonderful. So, Christy, maybe you can tell us, just if people want to participate in the Radnor Run or they want to find out more about the Radnor Run, how are we going to get them there?
Great. Well, come to the Radnor Run website to register, which is lung.org/Radnor Run. And you can choose to participate as a 5-miler, a 1-miler, or a volunteer. We need volunteers. It's a big event. We have about 1,000 people come out. So we need a lot of hands to make that work. So there's an opportunity for anybody who wants to get involved. We even still have some last-minute opportunities for sponsors. So yeah, people should come to our website to get more information, and then there's contact information where they can reach me if they need to.
Excellent. Well, I know it's a wonderful event to be a part of and to sponsor, so thank you for all the work you do to make it happen, and thank you, Doctor, for all the work you're doing to help us find cures and preventative measures. Hopefully we can save a lot more lives. Thank you both for being here today. I really appreciate it. It's been great talking with you.
Absolutely.
Thank you.
Our pleasure. Thanks.
Thank you.
And thanks again to Bryn Mawr Trust for being a sponsor and a partner.
We're happy to do it. We've been doing that for several years now, and we love participating. So you're welcome. And thank you for joining us today on Community Matters. It's been a pleasure having you here and a pleasure speaking with my two distinguished guests. You've learned a lot. Please go to their websites, learn more about how you can prevent and treat lung cancer. Clearly, it's something that we all could use some more awareness of. Thank you again. It's been Community Matters. Thank you for joining us.